All right, so with that out of the way, welcome everyone back to another episode of Herbal Prepper Live. Our show airs live every Sunday evening at 7 p.m. Eastern and 4 p.m. Pacific. Today is Sunday, September 24th, 2017. Welcome everyone who is tuning in live this evening. Hello to everyone who is in the chat room and to everyone who is going to be listening to this on the download later. Thank you for being here. Thank you for listening. I really do appreciate you guys tuning in every week and being here. And I love reading the posts in the chat room. And I really do. I just enjoy this just so much. And I wanted you to know that. And it's you guys that make this, a really pleasant and wonderful thing to do. So this week, we are very fortunate that we have our regular guest, frequent guest, I should say. Chuck Hudson is back this week, and we're talking about wound care and some of the basics of wound care. And there's a reason that I had him come on this week, and I'm going to be announcing that a little bit later in the show. But anyway, last week we talked a little bit about, I had a wrist injury, and I guess that sort of prompted this conversation between Chuck and I throughout the rest of the week. It's like, we probably really need to go back and review. It'll be a good time to review this. We used to have another show together where we were co-hosts there, and we talked about wound care a lot. But I don't think we've really covered it here on this show quite enough. And the thing with wound care is that, it's not enough to just read about it once. It's not enough to go get a first aid training once, and you've got to continue to keep your skills up. You have to read about it. You can watch videos about it. You can listen to shows like this about it, and then you got to practice it. You've got to put these into practice, whether you're trying to practice on yourself or whether you can get a volunteer to let you wrap something up. So, and then, we've also got a little bit of an herbal twist on things, where it's appropriate. So, Chuck is joining us. So I just want to introduce him to everyone who may be new to the show. Chuck Hudson is a former combat medic. He's a former EMT paramedic, and he is currently a survival instructor and founder of the Medic Shack, which is based out of New Mexico. And so welcome, Chuck, and thank you for coming back.
Hey, Kat, how you doing?
I'm doing all right. A lot better than last week, I'll tell you that.
Yeah, I do appreciate letting me come on with you.
Well, we love having you here. You're a fan favorite. You can say that. You're a fan favorite. You truly are. So, before we get started, let me see if I do have a couple of announcements, but there is an announcement I'm saving for the end of the show. So, but I want to just get through a couple of these real quick, and then we'll take our quick break, and then we will get into tonight's discussion. So if you're over at Blog Talk, come on over and join us here at Prepper Broadcasting. Join the chat room here. This is where we're paying attention. This is where all the questions get put into here. And let's see. While you're here, make sure that you check all of the other shows. The other hosts have archived episodes here too. Check all that out. Tons of information. Don't shortchange yourself. And for those who may be listening to the show for the first time, I have 2 books available that you really need to have in your Prepper library. Prepper's Natural Medicine is a crash course in herbalism. It covers core herbal skills, therapeutic properties of 50 different herbs, plus herbal formulas to get you prepared for both acute and chronic conditions. My second book, Prepping for a Pandemic, is loaded with critical information that you need to have. Prepping for a Pandemic delves into the hard lessons that we can learn from the Ebola outbreak of 2014 and how we can apply this knowledge to protect ourselves from future deadly pandemics. Excuse me. In this book, I also give you my top 7 picks for the next great pandemic. And I also give herbal and conventional options where those options exist. Sometimes they just don't. And there's just the best option there is to do a self-imposed reverse quarantine, which I also cover in the book, plus so much more. There really isn't another book like this on the market. So, if you needed 2 books that are going to give you a ton of information on how to get your health care prepped, these 2 will do it, and they'll do it very affordably. All right, so they can be found in the Prepper Broadcasting Bookshop on Amazon.com, BarnesandNobles.com, and everywhere books are sold. If you are lucky to have a local bookstore, they could use your support. So if they don't have it, they can always order it. And if you have a local bookstore, I'm very jealous. We don't have one anymore. So let's see. I think we're. Oh no, one last thing, and then we'll get in. Then we'll take our break. I have one quick announcement about my course, the Herbal Skills Intensive. It's like an 8-week herbal boot camp. Up until now, actually I should say up until October 2nd, the course has always been offered as a, like we started as a group, we get a bunch of people to enroll, and then we start as a group and we finish hopefully as a group. Starting on October 2nd, I'm simplifying a lot of things, and it's going to start with that course. And there's been stuff going on in the background on the website to make things simpler and easier. And believe me, I love the sound of that. But it's going to change in that instead of waiting for a group of people to get started, it'll be more of an open enrollment system. So you can sign up whenever you wish. You don't have to wait for there to be an opening and wait for another session to start. You can just take it at your own time. There's only one catch there. The tuition rate is going up slightly because in order to make this happen, I have some additional expenses that I have to cover to make this happen. So if you are interested in the course, it's going to be the same rate, the same tuition rate. Now it's $97. It's going to stay that until October 2nd. And then on October 2nd, it's going to go up to $149. So if you were thinking of taking it, you might want to lock that in before that changes. You do have to purchase your own herbs, but even though the course is set up for 8 weeks, if you need longer, it's not a big deal. It's set up into 8 modules. You could conceivably do it in 8 weeks. If you need more time, that's fine. The course isn't going to shut off on you. You can always come back. And even when you're completed with the course, you can always come back and look at anything on my site that you've ever finished. It's not just going to disappear. All right, so that's that. I'm saving one more announcement for the back end of the show. Let's go ahead, take a quick break here, and when we come back, we're going to start taking a look at wound care. Where do we start with that? So we will be right back. All right, so we are back, and we're talking with survival instructor Chuck Hudson about wound care basics, the essentials of wound care, and let me hand it over to you.
Okay, well, good.
All right.
Thanks for having me on. Wound care, it's a very, very easy subject, but at the same time, it can be made way too complicated. One of the first things about wound care you have to realize is stop the bleeding. You'd be surprised how many people will go out there and they'll take a bag of Quick Clot, they'll dump it onto a gushing arterial bleed and wonder why the patient died. I am not kidding when I say it like that, is I have seen paramedics bring patients into the ER with a blood-soaked patient and a pile of Quick Clot wrapped up with some Kerlex on it, and the EMT is wondering why the patient's dying. Stop the bleeding. Stop the bleeding. Stop the bleeding. You have to get that out of the way first. Remember, was it last week, Kat, I was on with you?
Yes.
Okay, last week, we talked about ABCs, airway, breathing, circulation. But I said realistically, though, stop the bleeding first because you got 80 seconds, 90 seconds for that, and then you have 4 to 5 minutes to stop the bleeding before you get a politician out of them. So, stop the bleeding is so important. And also, we talked about it a little bit last week, and this carries over here, is the old adage of on pressure dressings, because direct pressure is your best friend. If the patient isn't complaining, you're not holding enough pressure on them. And the old thing of the old days when we would take especially Boy Scouts was bad about this one, and the old Red Cross First Aid course, if you put a dressing on somebody and it soaks through with blood, put another one on top of it. Don't take it off because you might disturb any clot that's there. Okay, think about it. If you are soaking through a bandage and, You're worried about taking it off to disturb any clot. There's probably no clot there. So just a quick thing, and I'll put this into the chat room here. Let me see. I can't take this image off of here. Darn it. We talked about how much a dressing holds. So your standard 2 by 3 inch Army battle dressing. A lot of folks may have seen them. It's a gauze pad with some ties on it that you can put onto the patient and hold direct pressure with it. Okay, that 2 by 3 dressing will hold equivalent of a 12-ounce can of Coke. Right? Your medium battle dressing, which is a 4 by 5, about the size of a 3 by 5 index card, will hold 750 cc's of blood. Your large battle dressing, which is about 5 by 7, 1,000 milliliters, 1 liter of blood. And an abdominal battle dressing, which are huge, they're about 8 by 10 and about 1.5 inches thick, will hold 2.5 liters of blood. That's 50% of an adult's blood. So you have to get control of the bleeding. You need to know what type of bleeding is what. Remember, arterial blood is bright red, and it will shoot literally easily on a, say, like the brachial artery. It's the artery that comes underneath your armpit, and you can feel it between your elbow and your armpit. You can push down right there, and you can feel the brachial artery. It's about the size of a pencil, a number 2 pencil. It will shoot blood about from, say, that person's lying down. You cut that artery, it'll shoot and reach to their feet. Femoral artery is about ½ inch in diameter, about the size of a pinky finger on the average person. Okay, so that's arterial. Venous blood, dark red, and it flows at a steady rate. There's no pumping in it, or I shouldn't say that. There's rarely any pumping in it, and it's dark red and it flows. And in capillary blood, that's 90% of the bleeding you see in most injuries is capillary. It's kind of a dull red in color, and it's kind of a ooze instead of a big flow on that.
No, I just wanted to mention something. So just so that it's relevant, so to people so they can see themselves in the situation. What kinds of injuries are we looking at when we're thinking about, there are injuries that happen commonly on a homestead. You might be you might be hours away from a hospital. Or let's say something, you might be out hiking. You could fall. There are any number of accidents that could happen while you're hiking. Another type of injury there are many types of injuries, but scenarios where, unfortunately we have,
hurricanes. Good one.
Hurricanes. There's just so many of them. My head's kind of swimming. We've got threats of potential, storms, fires, and then, on the other end of things, home invasion, terror attacks and things like that. Civil unrest. You're out somewhere. You go out to dinner one night. Next thing you know, somehow something had happened earlier in the evening. Now there's a riot going through. Things happen, and
yep.
So.
But the most common wound that majority of people will deal with is a severe laceration. And that can happen, from examples that Kat gave. You live on a homestead. Common thing on a homestead, and I don't actually live in a homestead. I got about 1.5 acres out here in the middle of the prairie. But, my wife and I sit down and look at how dangerous things are. And one of the most dangerous thing is cutting wood. We heat our house by firewood. So you're going to have a jagged, ripped laceration from a chainsaw blade. Another thing that she mentioned too is the storms that we're having. Most of these will be a combination of crush, puncture, and laceration. By that, I mean, if you've ever seen these hurricanes or a tornado, seen a 2x4 flung through a tree. You can imagine what happens when you see that happens on a person. That's pretty common. Another thing is dirty lacerations in the floodwaters. There's a rescuer that he was in waist-deep, nasty, murky water and cut himself on some barbed wire. and ended up almost losing his leg due to what we call necrotizing fasciitis, or the fancy term for flesh-eating bacteria. But primarily, that will involve that type of bleeding would be laceration. Puncture wounds, gunshot wounds, and all that, as a general rule, unless they hit a vessel, don't bleed that much. You know, I know on TV shows a different subject. The guy gets hit, blood splatters everywhere, going forward, going backward. They fly through the air. But realistically, unless a gunshot wound hits a major vessel or a major blood-producing organ, there's not a lot of bleeding that comes out of them. But your lacerations. So let's start with the chainsaw. You know, if you've ever seen a cut from a chainsaw, it is horrible. It's about a half-inch wide, and it's just where, instead of a cut, it's where the chain has ripped out the tissue. Extremely difficult to get control of because of the gap in the tissue. You can't bring it together. One of the biggest things people worry about in emergency medicine and wound care is infection. And you know, it's right to worry about infection. However, you need to remember you can fix an infection, whether it with herbal medicine or Western drugs or a combination of the two. You cannot fix a dead person. We talked about this on the last show that we're on with Kat. Or
right. I had a friend that had messaged me, emailed me. Well, a friend wanted to know what you could do to stop bleeding. You know, when let's say you're out somewhere out in the, you know, I guess out hiking or whatnot, and you had suggested packing it with dirt. And I know that lots of people go, oh my gosh, how can you suggest that? But you can always do, like you just said, you can always deal with the infection later.
Right.
And just stop the bleeding now, because they'll die from bleeding out much faster than they'll die from an infection. And it's not to make light of an infection, but, you know, I mean, if that's what you have available, then that's what you've got available.
You know, you have to stop the bleeding. I know, it sounds like a broken record whenever we talk about wound care like this, but if you don't stop the bleeding, no matter how much dirt you pack in there, how much quick clot you pack in there, how pretty of a dressing you put on that thing, you are defeating the purpose. You're not going to survive. The person's not going to survive. But once you get the bleeding under control and you are back everywhere, you know, because the basic first aid is the same for everything. Stop the bleeding, either elevation, direct pressure, tourniquet, whatever you need. But you got the bleeding stopped. You got in a controlled area. You know, I mean, we're not talking like a hospital. We're talking like you're out in a homestead. We're in nowhere, New Mexico. You're 30 miles from the nearest town and 50 from a doctor. Now, you know, you need to take care of the wound. So one thing that always comes up in my wound care classes is, when are we going to learn how to sew? When are we going to learn how to suture? And realistically, suturing is the lowest on my list to do for wound care. The primary reason is you can, unless you can guarantee that wound is clean, you're defeating the purpose, because if that wound's not clean and every time you put that needle through, you're making 2 extra wounds. And I think it was a class I was doing with Daisy, is the reason why we give such a hard time about keeping the wound dry when you got sutures is those sutures, especially if you're in a poop hits the fan, you're probably using silk or rayon or even, what do you call it, dental floss to sew somebody up with. That wound, those suture ends, they act like the wick off a kerosene lantern. The body is warm and it's moist, and so it's going to cause, that heat is going to cause stuff to be pulled down into the wound, the same way a kerosene lantern works. You light the lantern, the heat of the flame brings oil up to the top of the wick. It's the same principle. That's why suturing is really, really low in a poop hits the fan situation. My thing is, after you dress it, after you clean it, you got the wound clean, you got the dress, well, no, we're going out of order here, I'm sorry. But after you got the wound clean and all that, then you only need to close it. Ideally, the best thing ever invented for closing wounds is super glue. And ZTA3 Exact Right cleaning is very painful, and we'll go into a little bit more on that. Super glue works very well. Just a word of advice with the super glue. I know I use my friend Cope Reynolds a lot as an example, because he always makes all these medical I won't call them mistakes, but learning experiences. He glued together, it did a beautiful job. He had a really nasty gash on his upper arm, and he glued it together with super glue. And he said for months it itched like crazy, and I went and I felt around in the wound, and I said, how much super glue do you use? He said, a whole tube. And what happened, he got a big old nodule that underneath the flesh, and it healed around it. And it was just a very bad irritant. Super glue is good, but problem with super glue, though, is you're back to how clean you've got it. If you seal that wound completely, you're getting that risk for infection, especially if you did like I advised last time, pack it with dirt. You got a lot of cleaning to do to get all that out. But, above super glue, as my all-time favorite, is steri strips. And steri strips are little bitty strips of tape, made by 3M. They're like $5 a package of 10 of them, 10 individual strips. But you don't need to buy those things like that. You use regular tape works really well. But the thing about steri strips is they'll pull the wound together, but they allow it to drain. And that is really important, especially in a dirty wound like a chainsaw cut or a hiker that hikes in the woods and falls and rips his leg open on a stump or a rock. Those really jagged, dirty wounds. You want to have an avenue for drainage on it. So I apologize for going out of order on this because we kind of went from stopping the bleeding to closing the wound. But we had a thing in here where ZTA 3 said cleaning can be very painful, and it is, especially if you used quick clot, or you use dirt, or you use any of the type of substances that cause blood to form around an object to make a seal. What we said about suturing, if you clean a wound with, and you don't get all that stuff out, you're giving bacteria a place to harbor. Also, like I talked about before, when you're going to clean a wound, you use whatever you have. Ideal solution is what's called Hibiclens and warm water or warm saline, either one. Hibiclens, you can buy it at Walmart. It's about $5 or a 4-ounce bottle, and you put a little squirt in there just to turn it the color of weak Kool-Aid. Next one is betadine. A small amount of betadine in a quart of water just to turn it the color of iced tea. Works really good to get in there, disinfect and clean, and there's not enough iodine in there to damage the tissue. If you don't have those, people start worrying because, I don't got the standards. I don't got iodine to clean a wound out. On the herbal side of it, there are so many things that work as well, and dare I say, Kat, even better than some of the chemical agents that we've come to use. But cleaning, it is so important. You got to get in there with a soft brush and physically remove all of the contaminants out of that wound. Because if you leave anything in there, you close that wound, you have made what we call an anaerobic without air environment in a warm, bloody incubation area that is just chock full of goodness for bacteria. So cleaning the wound, it's paramount. That's why I refuse to sew a wound in the field. Because there's no way, unless I'm in a controlled area with a controlled atmosphere, and it doesn't have to mean a clean room. It can be a tent that you can shut the windows on, but where you control the airflow. I will refuse a suture out there. For me, if the wound is that bad, and we have to suture it like that, what I'll do is I'll put 1 or 2 sutures in there just to hold it together. Just to bring it together and help control the bleeding and help protect the wound, dress it up, and let's move on out of Dodge. So before we go any further, any questions on what we've gone through on this? I know it's been a lot, in what was it, 20 minutes?
Yeah, that was a lot. That was a lot to digest.
I don't want to overbrush this.
No, that's fine. Let me see. There is a delay from when we're talking to when it gets into the chat room.
Right.
So I'm sure questions will pop up once that's gone through here. I know that you were mentioning on the herbal side of things, a very simple herbal wound wash. I mean, there's many that you could make, and there's many different herbs that you could use that have the ability to cut down on infection and such like that. But a very simple one is to get yarrow and make yarrow tea. And the thing with yarrow is that yarrow is known for helping to control bleeding. So in addition to it cutting down on, potential infections, it is going to help cut down a bit on the bleeding there as well. And the other thing that I would think of, we like to see wounds close from, we like to see them heal from the inside out. So when I say that, like you were talking, you don't like to suture, and I don't think anybody does. They don't want to suture like you said, in the field or prematurely, because there's the potential that something is growing, badly inside in that wound. So you've got some options. For instance, you can pack the wound with gauze that's been dipped in honey. That's one option. And I kind of like that option. That's going to be somewhat, not somewhat, it's going to, the honey, when it comes in contact with the bodily fluids, makes a minute amount of hydrogen peroxide, but on a continual basis. So when it's coming in contact with the tissue, it's also helping to kill any infection there. So it also helps to keep the tissue moist and, prevent infection at the same time. So let's see. I don't see any questions yet, but
okay.
Anyway, we can go on here from this. So when we start out here, you've got some kind of, we're assuming that someone has some kind of bleeding, and we're going to be putting pressure on it. We are going to be elevating that part of the body if it's possible, and so you have a few other tricks that are in your course on this that I don't think we can really demonstrate in this way here, like pressure points and stuff. But we'll cover that in another venue. But we do have a question from Lil again in the chat room. Would diluted colloidal silver work as well for cleansing wounds? I know nothing about that, so you take that one.
That one, yes, it would, but I would not dilute it because properly made colloidal silver, unless it's one of those newfangled hyper strength ones that you see purchased out there, normal colloidal silver is about 5 parts per million, and I have used it many times in cleaning wounds. I will say one thing about using colloidal silver to clean a wound is that it is entertaining. It burns. It burns a lot, but it also does a very, very good job of it. I have no problem at all using colloidal silver. I'm a very big proponent of it. I like it, but I know there is a lot of folks out there that do not like it. So we would, I don't like getting into that. That is great. Yarrow tea and all that. And yarrow, what it does, yarrow contains high doses of vitamin K in it, and that's how yarrow works. Stop bleeding too. It's very good for stopping bleeding. Pack the leaf into the wound, macerate it up. Whichever way you want. But yarrow contains, the reason why it helps stop bleeding, it contains vitamin K. And vitamin K activates what's called factor 8 and factor 10 of the clotting cascade. So you get people that tell you that herbal medicine's got no business in modern medicine. You can point to the actual science of showing where it actually works in the body. But I'm back to cleaning. Like Kat said, wounds heal you want a wound to heal from the inside out. And to do that effectively, you need to close the wound. And in closing it, there's so many different options. We talked about suture is my least favorite, and my favorite is super glue and Steri-Strips. But one that is coming on really strong to where I actually like it is staples. You can go to Amazon and you can buy a staple gun, skin stapler for, $10. And the thing about staples, yes, it's got the same disadvantages as a suture because you put a staple in, you put 2 holes in there. But the big advantage of it is it does not take any skill. Basically, if you can staple a couple pieces of paper together, you can staple a wound together. And what I mean, and where I like it is that if you've ever seen suturing, you have to lay out a big field. around the wound. Where the major reason is that 18 inches or 24 inches of suture, when you're pulling that through the wound and all that, you don't want it dropping off onto an unclean surface, an unsterile surface, and dragging that through the wound. A staple gun, you line the arrow up in the center of the wound, pull the trigger. In fact, you can do a staple gun without anesthesia, where suturing, you can do suturing without anesthesia, but it is literally 10 times more painful. If you use a staple gun, it's a sharp pinch, and it's done with because it's so fast. A suture, on the other hand, well, you can imagine pushing that thing through one side of the skin, through the wound, and coming back out the opposite way through the skin, how much that would hurt. With a staple gun, it pops it in. But again, on both of them, cleanliness of the wound is paramount. I mean, you absolutely have to have that out of the way.
So can I interrupt 1 second?
Yes.
So let's say, here's a hypothetical that, you are on your own. There isn't anybody else there. You have some injury, whatever, and it's bleeding. You've got to apply pressure on yourself there, which is not an easy thing to do.
Nope.
Talk to us a little bit about tourniquets and
one-handed pressure dressings.
Yeah.
Okay. We talked
because I know that especially when it, just when I know that when it comes to tourniquets, there's lots of different opinions on tourniquets. Okay. So I just want to make sure we touch on that.
So basically, first thing first is if you can do direct pressure. Direct pressure is it's always your first go-to. Pressure points and direct pressure. So this is where pressure points come in on this here. And let me get this diagram up, and I can talk actually people through it, through pressure points online. You have a bunch of different pressure points, and it depends on where you're bleeding on where you apply pressure. But say you have a bad laceration, it's lacerated the radial or the ulnar artery, or on what we call the dorsal or the underside of your arm. It is bleeding out. You don't have a tourniquet on hand to put on one-handed. You don't have anything. Two is you use a pressure point. So if you feel in between, use your thumb and feel in between your elbow and your armpit, in that area right there, feel it out and you'll find a pulse. That's the brachial artery. Pushing down on that artery will shut off the blood flow for both arteries down the arm, and generally buy you enough time to allow clotting to take effect so that when you release that pressure slowly, it'll stop the bleeding. You got pressure points all over your body. Basically, anywhere you can feel a pulse, you can do a pressure point. Now, the problem here is, okay, you got a pressure point, you need to dress that wound, but you let go of it, and it continues to bleed. Right here, you can use a compression dressing. What everybody should have, a compression dressing is better known as an Israeli or an H bandage. And what they are, they're just a very simple thing that we did in the early days of combat medicine, and somebody modernized it. You take an ace bandage and a maxi pad and wrap it on the wound. The ace bandage will hold, compression bandage will hold everything together. An eight or an Israeli bandage is the same thing. If you don't have one of those, you might have to put on a loose tourniquet or have a pre-made one like a cat application, yeah. Or you can have one of the many different varieties of them. If you don't have any of those, use your belt. That's why you see a lot of people now that call themselves quote-unquote tactical. They've gotten away from those great big plastic inserted nylon or leather belts that are extremely stiff. They've gone to a belt that's about 1.5 to 2 inches wide that are actually designed as a tourniquet. Put the belt, put the belt to the buckle, pull it tight, and if you can do it without having to twist it, you can hold the bleeding enough like that. It's so much fun. You have to use a tourniquet.
I lost you there for a second. Can you repeat that?
Okay, on which part? If use your belt. Like you see people nowadays have a kind of a web belt or a tactical belt.
Yeah.
You can use that. They work very good. Pull it through. If you can just pull it tight enough to slow the bleeding enough that you can manage it with the other hand and then get it dressed up, that's better. But the tourniquet, we've gone over this through the ages of the tourniquet. In the 80s, you put the tourniquet on and you release it every 15 to 30 minutes. The idea was to allow blood flow to keep the tissue alive. Well, lo and behold, people died because whenever you damage tissue, you get swelling. When you tighten the tourniquet down after you've loosened it and then retighten it, that tourniquet's going to compress that fluid that was released from the ruptured cells. It's going to stop the bleeding, but then that fluid's going to move out of the way and the tourniquet's going to loosen, the patient's going to bleed. Enter the 90s. Up until the early 2000s, they called it life or limb. You put that tourniquet on to save their life. And again, same thing happened as in the 80s. People were still dying from bleeding out. The reason why is you put that unclear, that gray area now, life or limb. What are you going to choose? You need to make a choice. And so people would literally sit there and think about it for 30 or 40 seconds, and by the time they made the decision, the patient had bled out. And also, too, they said, well, if you put that tourniquet on, you can guarantee that they're going to amputate that arm, leg, foot, hand, or whatever. And lo and behold, one of the things that came out of this horrible war in Afghanistan and that we're having is it's in my wound care book that I teach out of. There's a picture of the soldier that stepped on a mine. It's a nasty picture. His leg is literally hanging by shards of bone and threads, but those threads are actually blood vessels. So they tourniqueted him up. They put the tourniquet on him, stopped the bleeding. They called for a medevac. The medevac helicopter was shot down, and it took them 27 hours to get another helicopter in to get this special forces soldier out. And everybody was thoroughly convinced that that soldier was going to lose his leg. Lo and behold, they took the tourniquet off, they repaired the wound, and they were watching it, and the leg was still alive. And so they've come to find out that isn't a hard and fast rule that people are going to lose an appendage when you put that tourniquet on. So the new rules of the tourniquet now, if you think you need it, use it. Don't even think about it. If it's bleeding that bad, and you even have the slightest idea that you may need it, put it on, because you can always take it off.
So since you mentioned the book that you teach out of, you teach this as a class. It's got roughly 4 parts to it. Can you tell us a little bit about the class that you teach for wound care? What kinds of things do you learn in the class?
Well, this basic wound care class, it starts out, believe it or not, with just like we started here with bleeding. How to stop the bleeding, because like I said, if you can't stop the bleeding, you got nothing to go. It goes to direct pressure, elevation, pressure points. We talk about the types of hemorrhage, which we touched on a little bit, arterial, venal, or capillary. We also talk a little bit about a lot about external and even a little bit about internal hemorrhage. There is ways, if you can positively identify where internal bleedings come from, where it's coming from, you can slow it down enough to get that person real help. We talk about shocks. We talk about how to estimate blood loss, because your estimated blood loss, it gives you a lot of information on what else you're going to have to do after you stop the bleeding. We talk about bandages and dressing. And there's something that we talk about when you put on a dressing. It's called PMS, not postmenopausal syndrome, but pulse, motor movement, if they can move, and sensation. Because you can put a dressing on so tight that you can actually start cutting off circulation. Like I said, yes, you can leave a tourniquet on for so many more hours than it was thought, and the wound has the appendage has a good chance of surviving. But why chance it? That's why you put a dressing on. You check PMS. Make sure there's a pulse below the wound. Make sure that they can move, and make sure that you touch them below the wound. They can feel it. You know, we talked about the different types of dressing, from Curlex to Ace Wraps to what I taught Kat about the other day, a cravat, a triangular bandage. It's a standard of Boy Scouting. Combination bandage, which was the H or the Israeli bandage, and field expedient. Whatever you have on hand, your imagination is the limit on this. I mean, I've seen people come back literally with huge globs of moss and weeds and straw and grass underneath a torn up shirt to hold pressure onto a wound. And also, we talk about, the tourniquets and how to use them, when to use them. And we also talk about the chemical clot activators is what they're called. Quick Clot, Combat Gauze. Quick Clot is pretty much the only one left on the market because they're the ones that finally got it right. What else we go through in this thing? And then we also spend a lot of time on cleaning the wound prior to dressing it and prior to closing it. We actually got live demonstrations. Like a couple of examples that I use in my class is I'll buy 3 or 4 pork shoulders, and one will shoot twice, once with a full metal jacket, once with a hollow point. Another one, we will lacerate one with take a sharp knife and just do a cut on him. And a third injury is the crush injury. We'll hit something with a hammer and split the skin open. I'm sure everybody's seen that. And we go through how to clean those items like that. And then, of course, closing. It's a pretty heavily involved class.
But we were able to, this is what I was getting at earlier. Chuck and I have been working through his course book with some of the herbal stuff that I have at putting together a course to put on herbalprepper.com. And as my site's been morphing more into, an education site as opposed to just a blog or this or that, where the focus is on courses, because it's the practical stuff that you guys need. I mean, there's a dozen. Well, I shouldn't say there's a dozen. There's hundreds of websites out there that have the little short articles on, here's a list of things you need to prep, and here's a list of herbs that you can have on hand to make, a cold remedy or, a headache remedy or whatever. But those tend to be rather superficial, and I've been trying to focus on classes that cover far more detail, things, for those people who are actually really serious about, being prepared to take care of their health in case, we have some sort of in case medical care is not available. That's what I'm focused on. Those are the people that I want on my site. And Chuck sort of agreed to be the first, additional instructor besides myself on the website here. So we've been putting together a course based on both of our skill sets regarding wound care. Should be up within a month. And next week I should have, if you are subscribed to my newsletter, or also to Chuck's newsletter, because I'm sure he'll be sending it out too, this week there'll be notifications going out as to when the course is open for enrollment. And there's going to be videos. There's going to be lecture. There's going to be, I believe we can get some demonstration videos in there as well, not just the PowerPoint kinds of things. So there'll be some of that too, but then there should also be some visual tutorials. So it's the closest thing that we can get to doing a live class together. But since he's in New Mexico and I'm in Massachusetts, this is what's going to work. So
yeah, you can't tell by the accents.
Yeah, I know. So we're going to do this dual course together. And if you want, I would suggest that you sign up to, I know in my newsletter, I'm going to be sending out a coupon code for this to sign up on my site, and that'll be going out in Chuck's newsletter also. His website, you should probably mention that now, is themedicshack.net. Let me put that in the chat room, and you can tell them a little bit.
Actually, if you go into the search function of that, you can type in wound, and you'll see some of my prior newsletters and radio show that Kat and I have done on wound care. Remember wound care. It can be as complicated or as easy as you want, but just remember, first thing first is stop the bleeding. You cannot do anything else until you get that out of the way. After that, it's a matter of just following the steps. Stop the bleeding, inspect the wound, clean the wound, close the wound, dress the wound. That's really all there is about it. I mean, there are much bigger. There's other things in there. It's like you got to turn. You got somebody, and this is a good example because I've seen this one before. I've done it a few times, and I've known other folks that have done it a few times in the military, and I did it once on a logging camp. Guy ripped himself really bad with a chainsaw, and he cut what we call the popliteal artery. The popliteal artery runs behind the leg, and it's pretty deep, but it's a pretty good-sized artery. It's about the size of a pencil. Well, we get on him and stop the bleeding and all that, but we were literally days away to get this guy out. We had no radio, no phone service. Cell phones weren't invented yet. So what we did on this guy to be able to get him back in is that we cleaned out the wound. I cleaned up, really cleaned it out, sterilized in boiling water a pair of hemostat. And I went in there with a pair of hemostats and a pair of what we call pickups, people call them tweezers, and found the lacerated artery and just clamped that one artery and let the tourniquet go. And then we just used pressure and packing to stop the bleeding and got him to a hospital. It actually took us probably about 20 hours to get him to a hospital. But see, those are things that if you did them in the world the way it is today, you'd probably get sued. But if you do it in an area where you have nowhere and no one to turn to, you can probably get away with it. But it's
that's the point, though. Well, that's the point, though, because this is for when there's been there's a breakdown in services. There's a breakdown, perhaps in being able to get from where you're at to a hospital, or maybe the hospital maybe that's where there's a disaster already going on. Maybe the hospital has reached surge capacity. Think about the examples of the hospitals in West Africa during the Ebola crisis, because they were filled. They were filled. I mean, it wouldn't matter that you didn't have Ebola. Didn't matter. You might die from a heart attack. You might die from a complication from pregnancy. You could die from any number of things simply because there were no beds. So there could be any number of things going on.
Another example of today is the hurricanes that we have. Houston was hit bad. Florida was hit bad. San Juan, Puerto Rico really does not exist anymore. It's a major U.S. city. It doesn't have to be an exotic disease, that, makes you bleed out of every available pore in your body. It could be just a bad storm, and the hospital is gone. And that's what they're going through right now in Puerto Rico and in a lot of the Caribbean. Healthcare is gone. And Puerto Rico is being extremely hard hit because a century ago, this wouldn't have hurt them that bad. But today, nobody knows the basics anymore. Nobody knows how to clean a wound. Nobody knows how to stop bleeding. People are bleeding out on the streets, which I saw some video of it, with people trying to hold pressure with their hands on a bleeding artery, and a person dies because all they had to do is really take your knee, put on that wound, and put your full body weight on it. But they're afraid to hurt the person. It's a matter of, you can learn all this stuff in a book, but until you actually get down in there and put your knee or your hand or your point of your elbow into somebody's groin or into their armpit or whatever to stop the bleeding, it's a big, but that's what we intend to teach with this.
Well, we are just about 3 minutes away from being shut down. Yep. So we got to wrap this up here. I want to thank everyone for tuning in and listening. This is, wound care is a big topic because there's so many different types of wounds, and there's so many different, there's so many different things to keep in mind because of that. So I strongly suggest that you sign up for one of our newsletters. Keep an eye out for this course. This is probably the most practical course I've ever been involved with. So I just want to say, thank you for being here. If you like what you've heard, please do connect with me by following me on Facebook, Twitter, G+, Pinterest. Look for Herbal Prepper and all those places. Please subscribe to my YouTube channel. Check out herbalprepper.com. Check out themedicshack.net. I want to thank you, everyone, for being here. Thank you, Chuck, for coming on tonight. Thank you all. I hope you got something out of it. This has been Kat, the Herbal Prepper with Herbal Prepper Live. We will see you again next week. I have another guest for next week. Her name, I just have this out here. Her name is, Sherry Norton, and she is a firearms instructor, self-defense advocate.
Oh.
Yes, so she's going to be on next week. So I hope to see you all then. Thank you so much.